Hey, so today we're going to talk about overactive bladder, and I am known as the Hampton's bladder doctor for a reason. Hampton's bladder is a condition where you have to stop along the way from New York City to the Hamptons, and you pull over and it's really hard to find a restroom. So that 3-hour to 5-hour commute, depending on traffic, could be hell because you're looking for restrooms on the way there. So Hampton's bladder is a real big problem. I've experienced it myself, and we have treatments for it. Well, overactive bladder is a condition where you can't hold your urine, and the bladder has two functions: holding the urine and then actually urinating it out. And overactive bladder is when you simply just can't hold the urine long enough, and you have to pee sometimes 2 to 3 times every hour. Sometimes it's just whatever is making people uncomfortable. The main thing that people have with OAB is just going to the bathroom often, and that's could be nighttime frequency, where you go to the bathroom 4 or 5 times at night and you can't sleep, and a lot of times it's also during the day. So every hour you feel like you have to go to the bathroom, and when you go to the bathroom you're actually not peeing a lot. It's just your bladder's telling you have to go, but in reality you probably don't have to go. Well, the main thing is trying to have a full bladder when you go to the bathroom. So that's really important. A lot of times, if you just were in the bathroom 5 minutes ago, you don't have enough urine in there to really have to go to the bathroom. It's just your bladder's telling you have to go. So try to manage it by keeping like a timer when you're actually going. The other thing that I think is important is just watching what you eat, because a lot of foods that you eat can cause an overactivity of your bladder. Alcohol is a big thing. Coffee is a very big thing. So if you reduce coffee and alcohol, that would be very huge in terms of decreasing the amount of times you go to the bathroom. The other things that you can do also is just avoiding spicy foods. So certain foods and other beverages can create problems. Sometimes acidic beverages can be bad, and then sometimes spicy food. And when I talk about spicy food, I don't mean like hot spicy only. Hot spicy is the worst kind, but then there's also, like you put pepper in food, or you put any other kind of spice. Anything that gives food flavor could actually trigger the bladder to get irritation. Well, the first step of kind of like behavioral modification is what we try to tell patients, which is to try to hold it in as much as possible if you just went to the bathroom and you're pretty sure you don't have a full bladder. The bladder works best when it's pretty full. If your bladder is not very full, it doesn't work very well. So like if you have to go every hour and your bladder just has a little bit in there, like say under 200 mLs, you're really not going to be able to urinate very well. One of the tips I tell people is to do a bladder diary. There's a lot of bladder diary apps out there that you actually can record how much you pee at different time intervals, and that'll help because we'll know exactly how much you pee out every time. One of the things I tell people to do is to bring a 12-ounce cup around, and if you pee half of the cup, it's 6 ounces in there. And if you pee a whole 12 ounces, you'll record that. Usually you won't pee more than 12 ounces, but if you do, you just empty out the 12 ounces when it gets full to the top, and then you pee more on top of it. Basically, you can use a 12-ounce cup to measure as much volume as you possibly can, and accurately, so that we can document it in the chart. And then based on that chart, on this bladder diary chart, it can help urologists and even help yourself kind of manage how much you pee and when you pee. Do would be to kind of come in to get an evaluation of your bladder to see what's going on with the bladder. And we have a lot of simple, easy tests in the office. Well, first we check your urine to make sure there's no infection. Then we try to check your urine to make sure that how much is coming out, how fast it's coming out, to see if there's an evidence of obstruction on the pattern. Plus we then check to see how much is left over. All of that is done with ultrasound testing and just flow machines that evaluate the flow rate. So that's all done kind of in the bathroom. We have all that equipment right in the bathroom, so it's very comfortable, easy to do, and we evaluate it on the spot. So some of the treatments for overactive bladder that are very good and minimally invasive is PC treatment, which is an acupuncture type treatment where we put a little needle in the kind of base of your foot, and it doesn't hurt. And we do it here in the office. It takes about 20 minutes. We stimulate the nerve that goes to the bladder, and it relaxes it so you don't have to go as often. So that's really a great treatment. It's called Urgent PC. You can look it up yourself at the links that we have documented, and you'll figure this out for yourself how good it is. There's no side effects. It's very easy to tolerate, very minimally invasive, and it works about 80 to 85% of the time. So I recommend it a lot to most of my patients. I think it works even better than medication alone. So the mainstay of treatment for overactive bladder is medication. And, a lot of people give medication. I'm not a big fan of medication. Every time I do medication, that comes with side effects, and patients aren't as happy with the medicines as they are with other treatments that are easier, better tolerated. Medicines work in patients who just have very little time and are very motivated to take the medicine and don't mind having a small amount of side effect. The side effect is, dry mouth, constipation, and it's annoying enough where most people stop taking the medicine after about a few months. So that's why I'm not a big believer in medication. We started initially, and we see how people do. Some people are happy with it. Most people are not. So, I kind of know already that once you start medicine, to follow up and make sure that the patients are happy with it. Other treatments that we have, if everything else fails, is something called bladder Botox. And it's also a very minimally invasive treatment we do here in the office. It's very easy to do. It's not painful. It sounds like, I had an interview with the Daily Mirror where, they had a whole story about this bladder Botox. And it just sounds like a Botox procedure that's cosmetic, and in reality, this is a therapeutic one. It's not cosmetic. A lot of people consider Botox as a cosmetic treatment, but in a lot of uses now, it's not cosmetic, such as for headaches. We use it for people to have less headaches. And the other treatment that is not cosmetic that I know of is, there's a few others that are in different groups, but in different specialties. But the one in urology is bladder Botox, where we put a little bit in the bladder and it relaxes the bladder muscle directly. So it works for about 6 months, sometimes up to 8 months. And it works very well to the point where people don't need medicine or any other kind of treatments for their overactive bladder. There's other minimally invasive treatments for overactive bladder that are also considered cosmetic, but are for women, where we put in we do a treatment that's called Morpheus 8, and the treatment is an RF ablation with, so it helps build the collagen, helps improve the consistency of the vagina, but in addition, because the bladder and the vagina are so closely aligned, that a lot of times people report improvement in overactive bladder symptoms. And so it is a good treatment if there's an older woman after they have had kids. I think about this other treatment, which is called Morpheus 8, that can work on both improving the vagina, improving that aspect of it, and then also improving the bladder aspect of the problems that people have. So a lot of times they come together. One of the big problems I find with diagnosing overactive bladder is that a lot of patients have been told, and women particularly have been told, that going to the bathroom a lot is just a normal part of aging. And to that I say, if it's bothering you, it's not normal. Anything that bothers you should be treated, and shouldn't be just said, oh, okay, well, forget about it. We shouldn't really treat it. It's not going to kill you, so therefore it's not important. And the reality is that if it's bothersome, quality of life is just as important as any other medical problem that people have. So I really stress the need for kind of the proper diagnostic and the proper treatment. And again, I think a lot of that stems from the fact that medicines don't work very well. So they've been tried on 1 or 2 medicines, they don't work, and then basically everyone throws their hands up and doesn't want to treat it. So I'm different because I feel that things should be treated with all the technology we have, not just medicine, which is crude and doesn't work well. Well, NY Urology, I feel, is the best place to go for urology care. First of all, we have two convenient locations. We try to make it very easy for patients to get appointments, and we also offer as much of a as good of a patient experience as you could possibly get, in my opinion, because we have a lot of the testing and treatment right on site. Plus, we offer minimally invasive care, and I also present patients with options for all different kinds of treatments, not just the one I want to use. I think it's important for patients to make their own decisions, guided in the right way by the doctor. So I think it's great to have a kind of a 360 approach to medicine and try to give patients as much of the diagnosis and as much of the treatment options as possible, because a lot of times patients nowadays Google things, and they see things that may or may not be true, and it's good to kind of clean that out. So when a patient leaves my office, I want them to be able to Google the right things and not just Google just generalities that will lead to the wrong conclusions at times. So that concludes a little bit of the kind of overall picture of overactive bladder. I feel that we have a lot more to talk about. There's a lot of great things in urology that are up and coming that are very cool, and I think we'll see you in future videos.